Pulp vitality test. Pulp vitality test plays an important role in diagnosis of the status of pulp. Pulp tests are usually done before restorative or endodontic treatment to aid in treatment plan. Pulp that is vital is indicated for restorative treatment. Pulp that is non-vital is indicated for endodontic treatment. Pulp vitality tests are cold test, heat test, electrical pulp test cavity, anesthesia test, bite test, percussion test, palpation test. Cold test. Start with adjacent tooth first. Place an ice stick on the cervical area of the tooth where enamel is thin so that conductivity to the pulp is fast. Cold test. Three conditions exist. Patient feel immediate pain that lasts for 1 to 3 seconds after removal of the eye stick. Indicate vital pulp. Patient feel immediate severe pain that lasts for several minutes after removal of the eyes. Indicate irreversibly inflamed pulp. Patient feels nothing. Indicate non-vital pulp. Heat test. Starting with adjacent tooth first. Place hot instrument. Example, burnisher or hot material. Example, heated gatapaga over the cervical third of the tooth so that conductivity of the pulp is fast. Heat test. Three conditions exist. Patient feels immediate pain that lasts for 1 to 3 seconds after removal of the heated instrument. Indicate vital pulp. Patient feels immediate severe pain that lasts for several minutes after removal of the heated instrument. Indicate irreversibly inflamed pulp. Patient feels nothing. Indicate non-vital pulp. Electrical pulp testing. Starting with adjacent tooth first, place one of the electrodes black on patient finger and other electrode that is red on the tooth to complete the electrical circuit. Then apply little electrical current and increase it slowly. Electrical pulp testing. Turn on the device and slowly increase the electrical current and ask the patient to tell you when he feels pain. Each tooth should be tested 2 to 3 times and the results are compared. If the results are not definitive, test the adjacent tooth and tooth on opposite arch. If patient feels pain, then tooth is vital. If no pain is felt, then tooth is non-vital. Test cavity. This method should be used only when all other test methods provide inconclusive results. The tooth is not anesthetized and the tooth is drilled with round burr with water coolant. The patient is asked if he feels any pain during drilling. Do not expose the pulp. Test cavity. Two conditions exist. Patient feel immediate severe pain. Indicate vital pulp. Patient feel nothing. Indicate non-vital pulp. Anesthesia test. When the patient is not able to specify the site of pain and when other pulp testing techniques are inconclusive, this test is used. Anesthesia test. We anesthetize single tooth at a time using only intraligamentary injection. The most posterior teeth in the suspected quadrant is anesthetized first. If pain persists, repeat the procedure to the next tooth mesial to it. It is continued until the pain disappears. If source of pain cannot be determined, repeat the same technique on the opposite arch. Bite test. This test helps if patient complains of pain on mastication. Patient feel pain on biting if pulp necrosis has reached to pedial space or periapical area, or there is vertical fracture in the tooth. Bite test. Ask the patient to bite on a hard object, example cotton roll, toothpick or tooth sloth, on the suspected tooth and the tooth on the opposite arch. Patient report pain if there is a vertical fracture or pulp infection has reached pedial space or periapical area. Percussion test. Place your finger at the incisal edge, occlusal area of the tooth and gently press it inward. If patient feel pain, then periapical area is inflamed. If the patient report no pain, then periapical area is healthy. More accurate results can be obtained from radiograph and combination of other tests. Palpation test. Use your index finger and place it at the periapical area of the suspected tooth. The patient will report pain if the periapical area is infected. No pain if it's intact. More accurate results can be obtained from radiograph and combination of other tests. False negative results. Sometimes pulp test should show that tooth is not vital, but the reality is that tooth is more accurate and reliable results have been developed in some situations like one of the recently traumatizing techniques is their recently erupted teeth with immunofluometry, calcified canals, laser light to low battery in electrical pulp tester, transparent beam is received painkillers or psychiatric ducts or necrotic canal. It measures the pulse rate of other blood in the tooth and show the result in the screen. Techniques and advances. Measurement of temperature of tooth surface, trans-illumination with fiber optic light, detection of interleukin-1 beta, gas desaturation, radio-labeled microspheres, electromagnetic flowmetry. Thank you. Reference from Iraqi Dental Academy, Endodontic Diagnosis, Pulp Vitality Test.